Unless you're stuck in a car 100 miles from the nearest gas station when you feel the urge to pee, you probably don't spend too much time thinking about your urine. But just like paying attention to changes in your stool, taking a peek in the bowl on your pee breaks can too. Hi viewers, and welcome back to another Bestie video. You've probably heard that the color of your pee can tell you how hydrated you are, but urine can give you other information about your health. Aside from the basic yellow hue, pee can actually come in a rainbow of colors, some healthy, some not. And in today's video, we'll tell you what these colors are and what they mean. From purple, blue, brown, black to green and more. Watch till the end to learn about all of them. Number 1. Orange. Just like your skin can skew orange when you eat too many carrots, so can your pee. Overdoing it means you've delivered yourself a heaping dose of beta-carotene, which is then excreted in urine. Certain meds or over-the-counter UTI treatment, blood thinning, and some laxatives can also result in orange pee. The good news is you know you're taking these meds, and a good doctor will give you the heads up about color changes so you don't freak out. If you see more of a neon or fluorescent orange though, something could be up with your liver, especially if you notice a yellowish tint to the whites of your eyes. Orange pee that skews slightly more brown could also be a sign of dehydration. Have you ever had orange pee? What was the reason for it? Tell us quickly down below in the comment section. Number 2. Yellow. Bright yellow urine is a sign of excess B vitamins in the body, including B2 and B12, although this condition is harmless. Taking B vitamin supplements can lead to urine of this color. The yellow color darkens as the concentration of the urine increases. Concentration refers to the proportion of waste products to water. The urine darkens as the concentration increases because the body takes in less fluid. It also happens if fluid is lost by other means, such as sweating. People use the yellow in urine to indicate fluid balance in the body. It's also a reliable way to monitor hydration levels during exercise. Number 3. Clear. Clear urine indicates that you're drinking more than the daily recommended amount of water. While being hydrated is a good thing, drinking too much water can rob your body of electrolytes. Urine that usually looks clear is no reason to panic, but urine that's always clear could indicate that you need to cut back on how much water you're drinking. Clear urine can also indicate liver problems like cirrhosis and viral hepatitis. If you're not drinking large amounts of water and have ongoing clear urine, you should see your doctor. Number 4. Brown. One of the foremost reasons for brown urine is dehydration. Even a slight brownish tinge to yellow urine can mean you need to rehydrate with fluids. However, dark brown urine, rusty urine, or Coca-Cola colored urine can be a sign of rhabdomyolysis. This is a condition where your muscle tissues release a protein into the bloodstream, leading to possible kidney damage. This problem can be caused by severe injury, but today it's known for happening after particularly strenuous exercise, especially one that your body is not conditioned for. Along with dark and pungent urine, watch for muscle swelling and intense soreness. If you have symptoms of rhabdo, you need to call your doctor right away. Interested yet? Make sure you join our millions of followers and hit that subscribe button for all our great Bestie content. Number 5. Red. This is one of the most important colors urologists worry about because they have to make sure that it's not blood. First though, it could be totally innocent. Did you go to a juice bar and order a drink made with beets? A small percentage of people have a genetic alteration that makes them more likely to develop red or pink urine after eating red-hued foods like beets, rhubarb, and blackberries. Another relatively benign cause is runner's hematuria. This is when the bladder rubs against itself as you run, causing the appearance of blood in the urine after exercise. If this happens to you, don't brush it off. Get checked out by your doctor to ensure that it is indeed what's going on. When there's red urine, it can indicate a problem with organs like kidneys, ureters, bladder, and prostate. If there is a problem with your urinary system, you'll likely experience other symptoms as well. For instance, if you have a kidney stone, you might also notice back pain in the area over a kidney, frequent urge to pee, or burning urination. A urinary tract infection might also involve burning with urination, fever, and urinary frequency. Prostate problems can come with visible blood in the urine as well as a decreased urinary stream and having problems getting all of your urine out when you go. Finally, red pee could be a sign of cancer. Bladder cancer is the 4th most common cancer in those assigned male at birth. It presents with no symptoms except for a few drops of blood in the urine. Having any visible blood in the urine warrants a call to your doc to ensure it's not a UTI, stone, or tumor. Number 6. Cloudy and foamy. Cloudy urine can be a sign of a urinary tract infection. It can also be a symptom of some chronic diseases and kidney conditions. In some cases, cloudy urine is another sign of being dehydrated. Cloudy urine with foam or bubbles is called pneumaturia. This could be a symptom of serious health conditions, including Crohn's disease or diverticulitis. There are some cases where urine is foamy and doctors can't determine the cause. Urine that appears foamy or bubbly is typically the result of a very forceful urine stream. That may mean pushing harder than usual to make urine flow, or even elevated blood pressure. If it persists over time, you might want to have a urinalysis test. Foamy urine can also be a sign of elevated protein in the urine, which can be a sign of a kidney problem. Number 7. Fluorescent. In adults, fluorescence is a hallmark of antifreeze poisoning and typically only lasts for a few hours after the poisoning. Under a black light, the urine of someone poisoned with antifreeze will glow blue if the sample is obtained in the first 4 hours after poisoning. In children, it can be suggestive of antifreeze poisoning, but oddly enough, may be found in perfectly healthy children. It should not be used alone to diagnose poisoning in younger patients. Number 8. Green. Certain medications can lead to green urine, as well as eating asparagus. B vitamins can also lead to green pea color. None of these causes are that big of a deal, but green pea can also be a sign of a bacterial infection, which is worrisome. If it were a bacterial infection, you might have a fever and perhaps a milky appearance to your urine. See your doctor if you have any of these symptoms and your urine is green, whitish, or milky looking. Number 9. Blue. This is most frequently caused by the presence of food dye. Strongly colored foods, such as dark blue frosting, can result in a urine color change, as can asparagus. Blue urine can also indicate the presence of a bacteria, leading to a very rare condition called porphyria, or dyes used for medical testing. Some medications are also known to cause a blue urine color. This is not typically a sign of a kidney problem, but may still be alarming to the unsuspecting patient taking these medications. There's also a rare inherited condition that increases calcium levels and causes blue urine. This is commonly known as blue diaper syndrome. Calcium is very important for your bones and general overall health, and you should always make sure your body has enough of it. Learn how you can recognize the signs of its deficiency by watching 19 Signs You Are Suffering from Calcium Deficiency. Now back to urine colors and what they say about your health. Number 10. Purple. There is a very rare condition called purple urine bag syndrome that, as you might imagine, is typically found in people who have a Foley catheter to assist with urine drainage and collection. Oddly enough, the purple urine only happens when a patient has highly alkaline urine and a catheter in place. The urine doesn't actually change in color, it only appears purple in the collecting bag. If the catheter and collecting bag are changed, the urine again appears its normal color. Porphyria, a very rare condition, can also result in a purple color. Number 11. Black. Certain medications are known to cause black urine. The laxative sorbitol can result in black urine. Iron injections used to treat certain types of anemia can also lead to urine being black, but oral iron does not. Black urine disease is a rare condition in which the body cannot process specific amino acids. Number 12. Weird odor. There are many reasons that urine may have an odor. Dehydration makes urine stronger, which can result in an increased odor. Certain foods, such as asparagus, can make urine smell. There's also conditions that can result in unusual urine odor, such as maple syrup urine disease, which causes the urine to smell like pancake syrup. Sweet-smelling urine may indicate diabetes. Musty smelling is often the result of liver disease or liver failure. Foul-smelling urine is usually associated with the presence of a urinary tract infection. In general, urine odor should be concerning if it persists without explanation or is foul in nature. If it's food-related or due to dehydration, it should pass over the course of a day as you drink water and the urine returns to normal. One of the most common causes of discolored urine is kidney trouble. Learn how you can better kidney health by watching 13 foods that make your kidneys healthy, or 9 superfoods to lower your creatine levels and improve kidney health. So go ahead and watch one or both of these videos for maximum benefits. What's the weirdest urine color you've ever experienced? Let us know in the comments section below.